a compassionate environment and no rush trying to get through this work, hypervigilance comes down. And then it allows these unprocessed things, which is often causing us to be in that state of hypervigilance. It allows those unprocessed things to finally start processing. My name is Jamie Stern, and I am a therapist, and I practice brain spotting as one of my modalities. Brain spotting is a very innovative modality that assists a person to process trauma. It is something that is related to EMDR therapy for those who are familiar. It has been identified as an offshoot almost of EMDR. Brain spotting has some protocols that are very complementary to EMDR work that may have already been done with the client. Some of the positives that I see in brain spotting that might work really well for a client who's looking to do more trauma processing is the ability to process at a rather rapid pace, but at their own pace. So where it is different from EMDR is that in brain spotting, we're able to assist clients who might find that they have visual sensitivities. Sometimes EMDR is not always the most optimum fit for a brain spotting candidate because the movement might be a little bit too rapid for the individual. And this can trigger some sensory type issues if they have any. So if their nervous system is already very sensitive, let's say they're prone to motion sickness, maybe they have trouble in the car on a regular basis because their body is so stressed, that can be a fantastic modality for them to use if they find that EMDR is a little more intense for their nervous system. And the goal is for us to reach the client's nervous system. So using whatever modality we need to in order to access whatever the client is trying to access, that is what's most important. So whether it is something that is a large trauma for the client, or maybe it is a smaller scale trauma for the client, brain spotting can be very, very beneficial in accessing it. So who would be a good candidate for brain spotting? It's helpful, honestly, for anybody. Even individuals who have blindness can participate in brain spotting. So let's go into the way it works. So the way brain spotting works is that it allows us to naturally and organically find where our brain tends to store certain types of information. This is a very interesting quality that our brain has. It's as though we file things away. So the way I like to explain it to clients is that if you have your computer screen, it's your desktop, and you have all of your individual files on the desktop, you can click on it and access whatever is in those files. And so we kind of do a version of that when someone comes to session, and in that session, they bring up something that they're trying to process, or an intrusive memory that keeps on coming back to them, or a physical reaction that they can't make any sense of. Maybe it's fight or flight getting activated really quickly. But essentially, it can be used for anything, any type of trauma, depending on how the person takes to it, of course. But anyway, it can be used for just about any type of trauma. And what we end up doing is we observe where the client's eyes are going to access that information when they're talking about it. And they may glance off to the side a lot, just their eyes kind of going down, or maybe their eyes will go up. Their eyes will go somewhere. And that's very organic and natural to any type of conversation. So we see it every day. We see people accessing the information in their mind through their eyes, kind of navigating about. So when I catch or notice clients looking, glancing somewhere, I like to follow that glance. I follow where their eyes are going. And if they're all right with it, I invite them to just stay where their eyes are landing. And then as they're doing that, they have this stream of consciousness that becomes even more accessible to them if they were to kind of remove their glance and look elsewhere and keep on trying to tell me, what they're talking about from whatever might be in that corner or wherever it is. They find that it is harder to access the information because their eyes are not in the right location for it. So it's very, very interesting to observe that, but it's also very organic and very human. It flows with what we already do naturally. So I really like it as a modality. It honors the natural responses that we already have, or rather, the natural reflexes that we already have. So we will be looking at they'll be glancing off wherever they need to, and that's called gaze spotting. It's where your gaze happens to land. I like to do that one online a lot. I find it to be very effective and useful with clients. It's effective because they are in their own space. So they're already a little bit more comfortable. They're already a little bit more disarmed. They may have certain areas that their eyes are already used to going. Sometimes that happens too, and they're able to identify it. They're glancing off at the window that might be in the corner, or maybe the floor or whatever, and they might catch themselves doing this outside of session too. So it offers us a very good opportunity to just learn more about their psyche and what's coming up for them. So that was one form of brain spotting that I described, the gaze spotting. I enjoy using that one with clients because it flows so naturally. Another format for introducing brain spotting and utilizing it in session is to actually guide the client's eyesight. And I would move a whole lot slower than that, but very slowly I would move in frame, within the box, within the scope of what our computer screen is with them. It's not very easy to do this on a cell phone. So for that type of brain spotting, it's better for it to be on a desktop or laptop computer. Brain spotting can be used to address different types of symptoms like anxiety, hypervigilance, avoidance, all of it. And if there are more, anything outside of the spectrum of what I just said, more can be addressed. So specifically with anxiety, brain spotting is so honoring of what the client's experience is because we follow where their eyes are going, where their body is reacting. I also like to bring in it's already somatic to begin with, but I like to bring in more somatic work by noticing where in a person's body they might be feeling a lot of the activation associated with one of the symptoms that we might be trying to target and help process. So let's use anxiety as an example. If I were working with a client trying to help them process their anxiety, first, they're already in their own space. Ideally, they're already in their own space, so their body is already slightly less on guard because they don't have to have the hypervigilance that comes with being in a new place. And the anxiety will show itself quickly. We all know that it shows up, and the person might be feeling it in their chest or their head, but regardless, their eyes are going to go somewhere. And then I'll invite them to have their eyes stay in whatever location their eyes have landed. And we just notice what their body is feeling. And gently, I invite them to speak about what they're feeling, or they're allowed to process quietly, where words don't necessarily come up for them, but they're feeling it, they're noticing it, and they may report on it later to me, later on in the session. But that's where that processing is actively taking place. The eyes are in position wherever they need to go. And then by holding the person's gaze or eyesight in that specific position, they are sitting with their emotions that have been trapped in that file, wherever it's located in their surroundings, their visual. So we sit in that location. We let them feel it. They are discharging that feeling safely. They know that they are in a safe environment. They're at home. They have me attempting tremendous attunement and with a very, very gentle pace, not rushing anything. And by offering that, it allows safe processing of whatever it is that has had such a grip on them. And the benefit to that is that if they are a more silent type of individual, they can still achieve so much with this work. It does not require words. I'm a very wordy person, so words are always flying out of me. But for anybody who finds that certain just being asked to articulate while they're processing, so sometimes that's unhelpful for some individuals, and that's no problem. So this modality honors any type of silence that a person may need while they're processing. Um, and so this will honor those who are more on the avoidance spectrum. Those who are on the avoidance spectrum, they're feeling their fight or flight activate. They're feeling their body just wanting to get the heck away from what we're doing. And so using brain spotting, that can really, really allow them to address and access what is so painful for them. They're able to do it safely. And at the same time, they're not having to be performative. They're not having to remember, oh, I've got someone in my presence or watching me. They're able to just sit with whatever is going on, and then they don't have to avoid it as intensely as they might. Now, sometimes that will show up in where our eye gaze lands. So sometimes people will find that they've got to dart away. That's okay. That's absolutely okay. If they have to, I'm right there with them, and we dart away together. And then we hold space for that. And then slowly we will titrate it back. We may return back to that position if the individual is comfortable with it, or that new spot that they found might be relevant, and we'll go play with that for a little while and see if that can give us important information or show us something else that needs to be processed safely. And then through all of that, with a compassionate environment and no rush trying to get through this work, hypervigilance comes down. And then it allows these unprocessed things, which is often causing us to be in that state of hypervigilance, it allows those unprocessed things to finally start processing. We may need to return to that spot in different sessions, or we might be able to knock it out in one singular session. It depends on the magnitude of what's happening for the person, and also how they feel about it and how they feel about the whole brain spotting process, which invites another question. How do we suspend our disbelief when we are looking at a spot? Because it's a very weird sounding thing. It's different. It's not something that intuitively makes a whole lot of sense. And yet we actually all do it all the time. That poor kiddo in class who, the teacher, they're looking out the window and the teacher's like, hey, space cadet, where'd you go? Wake up, come back to us. That could very easily be an example of, defragging, but it could be brain spotting. The child might just naturally, have their eyes land in a position and they're kind of captivated by it. And they're busy just decompressing and processing something that needs to be processed. It's just, it's not great timing when it's in class. For those who are interested in brain spotting, I encourage you to reach out and find out if this is a fit that would be good for you. If you would, be interested in using this modality, we are able to do a consultation together, and I'm able to answer any questions that you may have. For those who feel like it might be a good fit for them, some helpful information to that would be if they are feeling like there's a lot of stuff in the background that needs to be processed, but they're struggling to identify exactly what it is. Brain spotting would absolutely be a good fit for that. Conversely, someone who knows exactly what they're trying to target, brain spotting could be a very good fit for them too. That's the adaptability of brain spotting. It allows a person to work with whatever is coming up for them. So if you are just noticing that stuff is coming up in your nervous system, things are bothersome to you, either you can't quite identify what it is or you absolutely know what it is, brain spotting can be of assistance to you. It also is a wonderful way of allowing a person to reconnect with their body. So there is an element of slight dissociation that sort of occurs. And I want to put that out there so that nobody feels frightened by it or, put off by it, because it is not antagonizing the dissociation that a person might experience. What it's doing is it's going into that little pocket where the person tends to go when they dissociate. And so that little pocket that they find themselves in, we go there with them. And so they are, for the first time, not alone going to that place. They've got somebody there with them. And that is the thing that makes it so different from any type of negative experience. They have backup. They have somebody whose voice is able to pull them back to themselves. And they also have the opportunity to really, really safely explore what might be in that mental file of theirs. And they are able to connect with that safety because we set up everything so that they are able to feel that security in their nervous system before we even get started.